We have a case of a 29-year-old white man who was found to have abnormal serum liver biochemistry test 3 years ago when he was first diagnosed as having ulcerative colitis. He denied any previous transfusions, gallstone disease, IV drug abuse, tattoos, or significant alcohol consumption. The patient had no family history of liver disease, and with the exception of his ulcerative colitis, he reported that he was perfectly healthy. Even after stopping all the medications, his liver function test results remain abnormal. His lab studies were significant for increased serum alkaline phosphatase, ALP, and aminotransferase levels elevated up to 3 times the upper limit of the normal. But his bilirubin level was normal, that is less than 1 milligrams per deciliter. Endoscopic retrograde cholangiopancreatography, that is ERCP, was performed and it showed multiple stenosis and dilatations throughout the intrahepatic and extrahepatic biliary system. The common bile duct and the extrahepatic portion of the common hepatic duct showed a beading pattern with a few prominent strictures. Now, what do these findings suggest? What disease is this patient suffering from, and how will you manage this patient? To answer all of these questions, let's study primary sclerosing cholangitis in detail on sqadia.com.